For diagnosis, according to Zhang for organ patterns, we take up damp cold in the large intestine. This is again a purely excess pattern of imbalance, but there may well be an underlying yang deficiency condition, which means that the body has difficulty protecting itself from exogenous cold or transforming cold foods that have been ingested. The large intestine can be directly invaded by exogenous pathogenic qi through the skin. If the person has had cold, wet clothes on the abdomen after they have been swimming, or has sat on the cold, wet earth. Damp cold can also result from consuming cold or cooling food and beverages, both thermally or energetically cold. Symptoms and signs are diarrhea, stools are watery and explosive, borborygmi, cramping pain in the abdomen. The skin of the abdomen feels cold when palpated. The abdomen can feel tense or distended when palpated. Aversion to cold, thick white and wet tongue coating, slow and possibly tight pulse. Key symptoms are watery diarrhea, cramping pain in the intestines. Treatment principle, drain damp and cold from the large intestine. Then we choose from stomach 25, stomach 36, stomach 37, REN 8, spleen 4, spleen 9, and bladder 25. Needle technique is draining, except for REN 8, which should be treated with moxa. Moxa or a moxa box on the abdomen is recommended. Stomach 25, stomach 36, stomach 37, spleen 4, spleen 9, and bladder 25 drain the damp cold from the large intestine. REN 8 with moxa expels dampness and cold from the large intestine. When there is damp cold in the large intestine, the person should avoid consuming food and beverages that are cold or have a cooling energy. They will benefit from drinking ginger tea or other spices that are warming and spreading in their dynamic. It is important to keep the abdomen warm and dry. Damp cold in the large intestine can be caused by spleen yang deficiency. Damp cold in the large intestine can result in yang deficiency. So to summarize, etiology would be invasion of exterior cold with possible underlying stomach qi or yang deficiency. Signs and symptoms, constipation accompanied by sudden abdominal pain, feeling of cold, diarrhea with pain, cold sensation of the abdomen, bland taste in the mouth. Pulse would be wiry and deep, especially on the right rear position. Tongue is white with scant, thick white coating. Scant, sticky white coating. Treatment principle, warm the yang and free the stool. Rectify qi and relieve pain. Acupuncture treatment. Stomach 25 will stop the diarrhea, regulate intestines. Stomach 35 will stop the diarrhea. Spleen 6 resolves damp in the lower burner. REN 12 resolves dampness. Sanjiao 6 frees the bowel qi. REN 6 warms the lower burner. Bladder 25 supplements the large intestine qi. Stomach 27 regulates qi and promotes urination. Spleen 9 for damp in lower burner. Bladder 22 regulates water passages. REN 4 dispels cold. REN 8 moves gastrointestinal qi, transforms cold stagnation. We needle with supplementation or tonification or even method with large amounts of moxa. Thank you for listening.